A new report from the American Heart Association is helping clear up years of confusion about caffeine and heart health. Now, for most healthy adults, the research says up to 400 milligrams of caffeine a day is generally considered safe. Some possible heart benefits include a lower risk of heart disease, but how you take your coffee matters. Black coffee may provide the most potential benefits, while, as you can imagine, all those added sugars, syrups, and cream can offset some of the advantages. Remember also, not all caffeine sources are the same. Energy drinks can carry more risks, and larger doses of it may trigger abnormal heart rhythms. So, here to explain more about all of this is Dr. Kash Hematpour, a cardiologist with UTHealth Houston. Doctor, thank you so much for joining us. We appreciate the time.
Thank you for having me.
Near and
Always
dear
a pleasure.
to my heart, because we get up early, you probably get up early. Coffee is an important part of the day. So what are some of your biggest takeaways from this, and how should we look at this conversation?
Well, number one, for those of us who were wondering whether or not that coffee morning habit is beneficial or harmful, this statement provides some piece of good news. So, as you mentioned, 400 milligrams, which translates into 3 to 5, 8 ounces cup of coffee, is generally safe for adults, individuals. But it matters how we prepare it. All these results, especially the health benefits, apply to the plain, paper-filtered black coffee and probably instant coffee. The reason is there is a substance named caffeine in unfiltered coffee, including like Turkish coffee, French press, and Scandinavian coffee, which can help or which can cause your cholesterol to rise. So that's number one. Number two is it really matters what you add to your cup of coffee. Large amounts of sugary, syrups or heavy cream can negate those benefits. Well, AHA went further this time and mentioned that not only it's safe, but moderate regular consumption of coffee can help prevent heart disease, including coronary artery disease, congestive heart failure, AFib, stroke, and diabetes.
Yeah, we saw some new big benefits out of this, but again, you don't want to counteract that benefit with all that stuff you add in, so at least try to minimize it. I know I can't cut it out all the way and drink the plain black coffee, but we can minimize it. You mentioned this quickly earlier, but they separate out coffee from energy drinks. These are two very different substances. Why are they so different? How are energy drinks different?
For two reasons. Number one, energy drinks contain a higher amount of caffeine, way more higher, so triple or quadruple times a plain cup of coffee. Number two, the way we are used to use them is different. People use it before working out or while they're active during the day. A large amount of caffeine can dehydrate you and cause arrhythmias, which combining that to working out and exercise can make things really worse.
And with our kids and our teens, we really want to watch that, because I know that that's a trend that a lot of teenagers are falling into. Certainly caffeine doesn't impact everybody the same way. Who should pay the most attention to how much caffeine they're getting and be a little more sensitive to it?
Well, but listen to your body. I mean, that's the key when I talk to my patients in the office. There's a variation in the genes, particularly CYP genes in the liver, that they metabolize the caffeine molecule. Some people metabolize it faster, some people not so much. So listen to your body. If you feel palpitations, tremors, or just a little agitation, just bring that 3 to 5 cups a little lower to maybe 1 to 3. Generally speaking, 1 to 3 should be fine.
Okay, so we mentioned it, but when we want this practical advice on how best to enjoy our coffee, grind it or buy it ground, put it in the filter, drip the coffee. Do you drink coffee, doctor?
I do drink coffee, 3 to 4 cups a day.
3 to 4 cups a day, and we've got the green light to do that, don't we?
Yes, absolutely.
I think this is good news. Dr. Kash, thanks for coming in
Thank
this
you very
morning
much.
for this coffee talk.
I appreciate it. Thank you.